Hello, in this short video I'm going to be exploring whether therapeutic photography is therapy. My name's Neil Gibson and I've been using therapeutic photography approaches in my work for many years. I use it with clients in my counselling and therapy service. I've written a book on the topic, therapeutic photography, and I also run training courses on these approaches as well. So, is therapeutic photography just therapy? In short, I would say no, but you can sense I'm a little bit cautious there. Therapeutic photography, for me, sits on a continuum. At one end of the continuum, you've got therapeutic outcomes that were not intended, a fortunate byproduct of what you do. So, for example, you might go out with your camera, take some photographs, come back and think, that was great and I've got some brilliant results. I'm really happy with that. Is that therapeutic? Yes, potentially. But it was, as I say, a fortunate byproduct of what you were doing. Therapeutic photography is a little bit more structured than that. And so we're moving up that continuum. So it's not therapeutic by accident. It's therapeutic by intent. You go out and you intend to use photography to explore yourself, your environment, and link it to understanding about who you are as a person. Now, I often say that to do that, there's a structure to that, and that's really just to kind of provide some boundaries. And certainly, if I'm working with groups of people as a facilitator, I will use structure because it keeps me safe and it keeps them safe in their exploration. At the far end of the continuum, we have therapy. And using photography in therapy is a fantastic thing. And when I do it as a therapist, I would say that it's not a structured approach. I use it as and when it's appropriate with the person I'm working with. It's usually suggested to them as a tool that they might want to consider using to explore a particular issue, and it's up to them whether they accept that or not. So I don't see that as a structured approach, I see that as an opportunity-led approach. So you'll see that continuum right down here. We've got accidental, not by intent, but therapeutic outcomes from taking photographs because we enjoy it and it feels good. In the middle, we're a little bit more structured about how we use it and how we sort of structure exercises to explore particular issues to enable better understanding about who we are. And then at the far end, we have opportunities in counselling and therapy. In a way, you could view therapeutic photography as being similar to self-help approaches. You can go into a bookshop or online and you can buy self-help books. And you wouldn't necessarily call these therapy, but they are aimed at improving and enhancing your well-being. And these approaches can be facilitated in group work to do similar things and have similar outcomes. And that is where I see therapeutic photography sitting. So you don't necessarily need to be a trained counsellor or therapist to deliver and to use therapeutic photography. Indeed, you can use this on yourself at any time. So again, that underpins that this is not therapy. It certainly has similar benefits to therapy, and that is great. But that's where seeing it on that continuum is useful, because sometimes you might be using therapeutic photography and it might feel like you're straying into the territory of therapy. So being aware of those boundaries is really useful. And that's not a bad thing. It just helps you understand your limitations, especially if you're facilitating these approaches, and think, okay, this is beyond what I can do as a facilitator. I maybe now need to think about suggesting somebody goes to see a professional counsellor or therapist. What I really like about using therapeutic photography is it's a gentle approach, because when somebody is using photographs to explore themselves or relationships or emotions or their life story, whatever, they are totally in control of how they do this. They're in control of what they photograph, they're in control of who they show that photograph to, they're in control of what they say about the photograph. So that to me adds layers of safety into this approach, so that the person who's engaging in therapeutic photography is as safe as they can be in this process. With structure comes time limits as well. So it might be that you're working with somebody and you get to the end of the process, or you're working on a project yourself and you get to the end of the process and you review the outcomes for yourself. You know, how was it for you? What have you learned about yourself? What information are you going to use now going forward? And that can be great. That can be really affirming when you get to the end of that process. But for some, it might realise that there's things or issues that have come up for them that they want to continue to explore. And again, that's where maybe linking into other professions might be useful, like counselling, like therapy, but maybe there's other resources that you can think about as well. So having an awareness as a facilitator of resources that you can draw upon is a useful thing as well. If you're at all interested in engaging in these techniques for yourself, or for using these techniques with people in your work or facilitating groups, visit my website. There's lots of resources on here. There's videos from other practitioners who explore how they use therapeutic photography. And also I've got some courses on offer as well. So if you're looking at being a facilitator, I offer training in terms of understanding some of the therapeutic benefits and the theoretical perspectives that help you understand what's happening and how to structure exercises as well. And for counsellors and therapists, there's also training on how to incorporate these tools into your practice and looking at the different modalities and how they shape our use of photography.